Pradaxa. Introduction for new users. Introduction. All blood clots are harmful. Select true or false. Correct. Blood clots are helpful when they form to stop bleeding. Blood clots that are unrelated to injury can be harmful when they form and move inside the blood vessels and interrupt blood flow. If the blood is too thin, it is more likely that a blood clot will form inside the blood vessels and heart. Select true or false. Correct. If the blood is too thin, it is less likely for a blood clot to form, but more likely for excessive bleeding to happen. That's why your blood will be checked on a regular basis. You were supposed to take your first dose of Pradaxa at 9 a.m., but you forgot. At 11 a.m., you remember that you still need to take your first dose. Should you take it? Select yes or no. Correct. If you miss a dose of Pradaxa but are less than 6 hours late in taking it, you can take the missed dose as soon as you remember. However, if you don't remember until it is time for your second dose, skip the first dose. You forgot to take your first dose of Pradaxa this morning. You didn't remember it until it was time to take your second dose. Should you take 2 doses of Pradaxa to make up for the missed dose? Select yes or no. Correct. Since you are about to take the second dose, you should skip the first dose and only take the second dose. People taking Pradaxa do not have to check with their doctors when taking over-the-counter medication. Select true or false. Correct. Different medicines can drastically affect how thin the blood is. That is why you should check with your healthcare provider before taking any medication. This includes prescription, over-the-counter, vitamin, and herbal products. Women who take Pradaxa can never become pregnant. Select true or false. Correct. You can still become pregnant. However, Pradaxa may affect the pregnancy. You should talk to your healthcare provider about your plans for pregnancy to determine if Pradaxa is the right medication for you. Internal bleeding is more likely when the blood is thinner than it should be. Select true or false. Correct. Internal bleeding is more likely when the blood is too thin. If you see signs of internal bleeding, such as dark urine or stools, inform your doctor immediately. If you follow the exact prescription of your doctor, it is impossible for internal bleeding to happen. Select true or false. Correct. Internal bleeding can happen even if you follow the prescribed dosage. This is why it is important to tell your doctor if you notice any sign of internal bleeding. Minor bruises are a normal side effect and do not require that you call your doctor. Select true or false. Correct. Minor bruises are normal and do not require your doctor's attention. However, large areas of bruising or unusual bruising are not normal, and you should call your doctor if they happen. Thank you for using Explain.